Diabetes affects 20 million people in the United States. Let's put that into perspective. If you were in a room of 100 people, 7 of them would be diabetic. Let's break it down a little further. Of those 7, 2 would have no idea they're even diabetic yet. Hi, my name is Leanne, and I work with the Mauston ambulance. The single most common test that I perform on a call is the blood glucose test. The reason that I'm doing this presentation is to show you what supplies you'll need as far as doing the test, what questions to ask your patient and what to report, and maybe what some treatment or signs of low blood sugar would be, as well as the normal and abnormal ranges of a blood sugar glucose test. So let's go over the supplies. Supplies, of course, are going to be your gloves, which protect you against any bodily fluids, whether it's blood or vomit or anything else. You're also going to need a gauze pad, which you use to wipe off the first drop of blood from the test, and then to follow up afterwards applying pressure after you've poked the patient. You'll need an alcohol prep pad to clean your patient's hand or finger for doing the test. You're also going to need a lancet strip, a test strip. This you'll be putting into your machine, which is your glucometer, and that turns the machine on. You're also going to need your lancet. This comes with the safety feature of the twist-off cap. So you twist it off, you're already loaded and ready to go. So keep that in mind. Once you push that button, it's going to eject a sharp object. The other thing that you're going to need to keep in mind is when you open a new package of test strips, you're always going to have a calibrating strip. And you'll poke that into the machine and let it recalibrate for each set of test strips that you have. So, given that, let's go ahead and do this test. I have my test subject here. If you'd like to give me your hand. Again, we're putting on our gloves, which, as I said before, protects you from any bodily fluids. We're going to first clean the finger. Okay. I'm going to get my gauze pad ready because I'm going to poke the patient. One of the things to keep in mind is if that patient is on any blood thinners like aspirin, Coumadin, anything like that, they may bleed very easily. So that's why you want to have that ready. As I said, when you put the test strip in, that's going to turn on your machine. It's ready to go. Your lancet's loaded. You poke the patient. I always get rid of that in the sharps container. That way you don't have to worry about getting poked again. Wipe off that first drop of blood. Then you're going to have the patient put their finger and their hand down, and you may have to milk the finger a little bit to get a good drop of blood. You put the test strip just up to the blood and it wicks up. The machine does the rest. It knows how much it needs, and you instruct your patient to go ahead and apply pressure. Okay, we have a reading of 116. The last thing you're going to do is put a Band-Aid on your patient, and that just prevents them from having any infections later, and also adds just a little bit of pressure again so that it doesn't bleed. Then at this point I would grab my pen and paper and I would write down the time that I took the test. Record that because you're going to need that for when you report to the hospital. I would then turn to the patient and ask them, are you diabetic?
Yes.
And make note of that. Are you on medications for your diabetes?
Yes.
And what are you on?
Insulin.
And make note of the insulin. What time was the last dose?
7 a.m.
7 a.m. Have you had a meal since then?
Yes.
And what time was your meal?
Noon.
Noon. Okay. Now, I said I would go over the ranges. Normal range is going to be 70 and above. So this patient is not low. His blood sugar was at 116. If it was under 70, at that point I would call into the hospital, give them my report and what the blood sugar reading was, and get a protocol for treatment. So, let's go over the procedure again while I'm cleaning this stuff up. You're going to put on a pair of gloves to protect you. You're going to clean the patient's finger with an alcohol prep pad. You're going to then poke the patient with the lancet. You've twisted off the safety feature on that. Once you've poked him, right away put it into the sharps container. You're going to wipe off that first drop of blood. You're going to turn around. You've inserted your test strip. You're going to take the test strip up to the droplet of blood, the second one, let it wick up, and let the machine do its work. In the meantime, you're going to put a pressure dressing on the patient, and then you're going to apply a Band-Aid, and then follow up with the information that you gather from the patient on their history. If they were unconscious, maybe there's someone that's with them that called for the ambulance, and maybe you can get some of the information from them. I'd just like to recap with a couple of reasons that somebody might have a low blood sugar. It might be that they had increased physical activity. Maybe they were outside biking all day, and it's not something they do in their normal day-to-day living. Other things, not eating on time. He said he took his insulin at 7 o'clock that morning, but he turned around and didn't eat until noon. Well, usually after about an hour of not eating after you take your medicine, they'll start exhibiting low blood sugar signs. What are some of those signs and symptoms? It could be shakiness. It may be that they get real cold and clammy. It may be that they have difficulty concentrating. Maybe they're having a hard time talking. They could be slurring, which is very similar to someone experiencing a stroke. So that's the reason this is an easy test for us to perform out in the field, but at the same time, it can either rule out or give us information of what's going on with them. Some of the other things, they may have excessive hunger, headache, dizziness, those kind of things. Treatment. His sugar was not low. At this point, I would probably suggest that he just eat a sandwich, have a glass of milk, but then also take him into the hospital if he's exhibiting any of those signs or symptoms. Or the other thing, when you call for protocol, would be to do oral glucose or the glucagon injection. Excuse me. So just keep in mind, the more you practice, the easier it'll be, and that's all there is to it. Thanks for joining me today.